Thank you for catching our on-demand lecture series. I'm Joanna Pauline Baltazar, a fellow from the Division of Colorectal Surgery from the Philippine General Hospital, and I'm here to introduce the speaker of our next lecture entitled, Diverticulitis Among Asians, Is It a Different Disease? Dr. Armando Crisostomo is a current professor of surgery from the Philippine General Hospital and the Vice Chancellor for Research in the University of the Philippines, Manila. He's also an affiliate faculty for the National Teacher Training Center for Health Professionals in UP Manila and a past president of both the Philippine College of Surgeons and the Philippine Society of Colon and Rectal Surgeons. He was recently awarded Legend of the Knife by the Philippine College of Surgeons, but to us, he is also Legend of the Mic. Again, I welcome Dr. Armando Crisostomo.
Hello. The title of this talk is about diverticulitis in Asians. Is it a different disease? I have no disclosures to make regarding this talk, except that this was initially delivered for the Malaysian Society of Colorectal Surgeons in early March of 2020. And I thought it best to share this with the rest of the Philippine community. Diverticular disease is considered largely a development of the 20th century, although it was first described by Litter in the late 1700s and described by Grasser as a disease entity called diverticulitis in 1899. Beer began correlating this with histologic and clinical features in the early 20th century. There is sometimes some confusion and interchangeability among the definitions. So let us clarify that diverticulosis is really structural abnormalities with submucosal herniations to the weak areas of the smooth muscle of the colon without clinical symptoms. Diverticular disease is a condition in which symptoms appear combined with diverticulosis and or complications. And it subsumes symptomatic diverticular disease with IBDS, IBS-like symptoms, such as post-diverticulitis, diverticulitis, and complicated diverticular disease. Symptomatic diverticular disease is the persistence or recurrence of symptoms without signs of diverticulitis or other complications. Diverticulitis is defined as an inflammation of the diverticulum, causing a symptom complex of abdominal pain accompanied by raised inflammation markers like fever and tenderness. Complicated diverticular disease is related to the formation of complications like abscess, fistula, colonic perforations, stenosis, leading to partial obstruction and even bleeding due to an inflamed diverticula. There is still much discussion on the etiology and pathophysiology of diverticulosis and diverticular disease. It appears to be multifactorial, resulting from a combination of structural abnormalities of the colonic wall, disordered motility. For many years, the role of fiber has been blamed mainly because it has a higher incidence in countries which are rather low in fiber, although there is not an iota of proof that tells us that intake of higher fiber will prevent the occurrence of progressive diverticular disease in the colon. Other conditions that have been implicated include lack of physical activity, smoking, the use of NSAIDs, and caffeine ingestion. It has been found to be more common in industrialized nations, and the prevalence increases with age. For patients under 30, it occurs only in about 1 to 2% of the population, but can occur as high as 40% of the population over 60 years of age, 10 to 25% of whom will develop diverticulitis. The Western populations demonstrate a tendency to acquire what we call left-sided disease with an increasing number and more proximal location of the diverticula with advancing age. Right-sided disease, which is the topic of our discussion, is found to be more common among Asians like us and can occur about 70% of right-sided disease occurring in the Asian population. This diagram illustrates the pathophysiology of acquired diverticular disease from a healthy colon, as shown here on the left, with colonic dysmobility and other structural weaknesses leading to the formation of saccular outpouchings, which we now describe as colonic diverticulosis. And this can lead to vascular disease or structural weakness leading to either diverticular hemorrhage or a microperforation with bacterial translocation associated with localized ischemia leading to diverticulitis. Right-sided diverticular disease may either be congenital or acquired. Majority are considered congenital or true diverticula. Most of these are solitary and are thought to arise as a saccular projection as early as the 6th week of embryonic development. This may be associated with angiodysplasia or vascular malformations, and that is why most of the bleeding comes from right-sided diverticular disease. Some right-sided diverticular disease are acquired or false diverticula, very similar to the left-sided sigmoid colon diverticula, characterized by the herniation of the mucosa and the muscularized mucosa through the colonic wall. These are usually invested with a thin layer of submucosa that is forced out to the weak points in the muscularized propria, with the tips ending in the colonic subserosa. This has been generally associated with increased colonic intraluminal pressure. Right-sided diverticular disease, mainly presenting as cecal diverticular disease, was first described by Potier in 1912. The incidence remains low in the Western population, and as we have previously mentioned, more common in the Oriental population, reaching up to 50% in some series. It is occurring more frequently in a younger set of persons, 35 to 45 years, in contrast to the left-sided diverticular disease. It is frequently misdiagnosed because of the right-sided hemiabdominal pain, frequently in a young patient misdiagnosed as appendicitis. The etiology remains rather unclear. There are some studies on the surgical treatment, on the treatment of right-sided diverticulitis, and as you can see from this table, majority of the reports are coming from Oriental countries like Japan, Taiwan, and Korea. And fortunately, majority of them were successfully treated conservatively. Surgical treatment usually is required only in about 10 to 30% of patients, and recurrence is rather uncommon. But that is not our worry in this lecture or problem. There is a clear role of ethnicity, as can be shown here. The reports of right-sided and or the location of the diverticula, you can see that in Oriental countries like Japan and Korea, Singapore, Thailand, are predominantly right-sided diverticula. And so the question that is posted at the beginning of this talk, is it really a different disease entity, right-sided diverticulitis among Asians? And perhaps the answer is in genetics. And how was that established? In two countries, Denmark and I think in Sweden, they studied the occurrence of diverticular disease among twins and found a concordance of diverticular disease which was higher among twins, whether they were monozygotic or what we call identical twins, or dizygotic or non-identical twins. They found that on monozygotic twins or identical twins, the likelihood of the twin having diverticular disease as the partner is 15 times more than the general population. Also, in non-identical twins, they had a more than 5 times chance of getting diverticular disease compared to the general population. This compares the Swedish twin registry and the Danish twin registry. And based on calculations and projections, they found that based on the Swedish twin registry, genetic factors can account for as high as 40% of the occurrence of diverticular disease among twins, while in the Danish registry, it is even higher at 53%. Perhaps the most important landmark study is what we would term the GWAS study in Korea in 2018. It is the first genome-wide association study on the susceptibility to diverticulosis in the Korean population. And they found a total of 9 SNPs or single nucleotide polymorphisms that were inextricably linked to the occurrence of diverticular disease in their population. Of these 9 SNPs, 3 were linked to the WNP4 gene, which is known to be related to smooth muscle wall proliferation. 4 of these SNPs were found to be near the RHOU gene, which is related to because it mediates the WNP signaling pathway, which regulates cell morphology, cytoskeletal organization, and cell proliferation. RHOU gene also functions as a pro-angiogenic molecule and enhances human endothelial progenitor functioning. And because of this, these genes may underline the pathophysiology behind diverticular bleeding, predominantly coming from right-sided diverticula. The last 2 SNPs were found to be linked to what they call the OAS1-3 genes. This is induced by interferon and is associated with antiviral and apoptotic responses. This OAS gene locus could be related to chronic low-grade inflammation of the colonic wall, which is thought to be the pathophysiology underlying the development of diverticulosis and eventual diverticulitis. So please remember, because I think in the future, this is a landmark study that will be cited in future genetic studies on the etiology of right-sided diverticular disease among the Asian population. In summary, we're finding an increasing prevalence of diverticular disease worldwide. It appears to be multifactorial in etiology. The right-sided diverticular disease has been significantly found to be more common in the Asian population. They are mostly solitary and congenital or true diverticula. There is increasing evidence of a genetic etiology due to studies on twins and their higher likelihood developing diverticulosis on both twins, and the pioneering GWAS study that I cited in Korea. However, we may need to do more genetic studies very similar to what was done in Korea in different Asian populations in order to further establish more proof on this particular genetic causation. Thank you, and it was a pleasure delivering this talk for you.
Dr. Crisostomo, thank you for that comprehensive lecture on diverticulitis. Certainly, right-sided diverticulitis and diverticulitis among Asians are something to think about. If our viewers would like to catch more on his expertise on diverticulitis, please catch Dr. Crisostomo's lecture on controversies in management of diverticulitis in the colorectal sessions in the 57th Mastery in Surgery Annual Convention on November 6, 2021 from 3 to 7 p.m. I would also like to invite you to catch another lecture of Dr. Crisostomo here in our on-demand lecture series entitled Neoadjuvant Treatment for Rectal Cancer, a Simplified Approach. Thank you for watching.
That concludes this on-demand lecture. We would like to award this certificate of appreciation to our speaker for sharing his knowledge and expertise with us. Please don't forget to answer the evaluation form. The other lectures by our local and international faculty may also be viewed through our convention website.